Your physician has prescribed medication to help you breathe easier. This medication is to be taken using a compressor nebulizer. Compressor nebulizers provide air pressure that works with a nebulizer cup to turn liquid medications into a fine mist. This allows your medication to go directly into your lungs. When unpacking your shipment, you want to ensure that you have the following pieces for use: the InnoSpire Essence Compressor with AC power cord, tubing, side stream nebulizer cup, mouthpiece. Additionally, you will have your prescription medication that you'll be using during your treatment. It is very important to wash and dry your hands thoroughly each time before using your nebulizer. Place the compressor on a flat, sturdy surface and plug it in. Connect one end of the tubing to the compressor, then assemble the nebulizer cup and add the tubing together as shown. When you are ready to add medication, place the nebulizer kit on the parking post at the rear of the nebulizer. Remove the mouthpiece and pour in the medication. Return the mouthpiece to the top of the nebulizer cup and remove the kit from the parking post. To take the treatment, sit in an upright position. Turn the compressor on and make sure mist is visually coming from the mouthpiece. Place the mouthpiece between your teeth, surround it with your lips, and slowly take consistent, deep breaths in and out through your mouth. Continue until all the medicine in the cup is gone. The nebulizer will often begin to make a sputtering noise when the medication is nearly gone. If the medication sticks to the sides of the medicine cup during treatment, you can gently shake the cup to loosen it. When complete, turn the compressor off and unhook the nebulizer kit from the compressor. It's important that you keep your nebulizer unit clean in order to prevent infection and ensure proper use. After each treatment, disconnect the nebulizer kit from the end of the tubing. Take the pieces apart. Be sure you remove the baffle as well. Then rinse them thoroughly with warm water. Shake off excess water, then lay it on a paper towel to let it dry. Do not use a towel made of cloth in order to avoid fibers clinging to the pieces. Do not rinse or clean the tubing. At the end of each day, put the pieces in warm soapy water and let them soak for 10 minutes. Dawn dishwashing liquid works great. The only soap to avoid is ivory, as it will leave a film behind. Rinse them thoroughly and let it air dry on a paper towel. They can be left to dry overnight if needed, or once they're dry, you can place them in a Ziploc bag to keep them clean. Again, do not clean the compressor tubing. If your nebulizer kit is not working as effectively as normal, usually this will happen after 4 to 6 months, it's time to throw it away and use a new one. To avoid any bacteria growth, once a week you need to disinfect the pieces by soaking them in a solution comprised of 1 part white vinegar to 3 parts water. Let them soak for 30 minutes. Then be sure to rinse the parts really well. Your nebulizer has a filter made of plastic that needs to be checked monthly to see if there's any discoloration. Filters should last 6 months, but be sure and check them, and if you see any discoloration, they will need to be replaced. If you have any questions or need any further services, please contact VieMed at 337-504-3802 or visit our website at viemed.com.